Welcome to Sydney, Australia. My name is Alan Menezes. I'm the founder of the Pilates Institute of Australasia. I've been in this business for almost 20 years and introduced the Pilates method to Australia in 1986. Due to an increased demand for support programs outside the studio, I produced a book in 1998, The Complete Guide to the Pilates Method from Lower Back Pain to Muscle Conditioning. This book is now the basis of a series of 4 videos which I'm really excited to bring you, based from lower back pain, the basics, the intermediate, and the advanced routines. This program for lower back pain is designed for those who suffer from chronic and mild lower back pain. It is not designed for those who suffer from the acute stages of any pain. As with any exercise program, consult your practitioner before starting this regime. Right, so let's talk about the postural aspects and the implication on back pain. We have Joe and Brooke, who've got a lot of experience with severe back pain in the past, who will be doing our demonstration for us. As we go through the exercises, there will be tips appearing on the screen in order to assist you to do the exercises correctly. So, when talking about posture, what we'd like to do is get Brooke to face me and Joe to turn around, and look at the shoulders when we first start, to look at the neck area, the shoulder area, the lower back, the knees, and the feet. So, from this angle here, we can actually see whether there is a lordosis in the neck area, in the cervical area, a kyphosis in the thoracic area, or another lordosis in the lower lumbar area, and whether there's also a hyperextension of the knee area. When people generally tend to stand around and move, they generally tend to hunch their shoulders. And with the shoulders hunched, you can see the effects on the neck. Very, very tight in the neck area. So relax the shoulders and make sure that the shoulder blades are pressed towards the hips at all times, while keeping the neck area long and tall. Okay, if we can turn again to the front and to the side. What we're going to start working on from now is the posture. So your posture actually comes from your feet. So if we have a look at the feet area here, what we're looking at is whether the arches are fallen or not. And if the arches are fallen, what we have to do is correct this. So when we're actually standing, we need to stand on 3 points of the feet, which we call tripods. And the 3 points of the feet are the ball of the big toe, the entire outside edge of the foot, and the center of the heel. And stand with equal pressure on those 3 points. Okay? So when you're standing with equal pressure on those 3 points, what you will actually find is that you're creating arches where your arches should be. And when that happens, you may feel a shift in back pain, a reduction in back pain, in fact, and there could actually be a shift in the hip area so the hips are more relaxed and comfortable. The next area we go into is into the abdominal area. The abdominals should remain as flat as possible at all times. So keep drawing the abdominal muscles in as hard as you possibly can to the spine. And now try and take a breath in for a 5 count. We'll go into the breathing in a minute, but for the time being, we'll just take a deep, comfortable breath in for a 5 count. If a 5 count is too much, bring it down to a 4 count. So breathing in, 2, 3, 4, 5, and sigh out of the mouth, 2, 3, 4, 5. And again, the breathing is always breathing in through the nose, and sigh out of the mouth. Never hold your breath and never blow. Because when you blow out, take a breath in and blow out. And as you blow out, you actually can notice that the neck starts to tense up. So always sigh out, it relaxes the neck and shoulder area. Now, keeping the abdominal muscles drawn in, take another breath in for a 5 count, and you may find that the breathing is actually quite restricted when you're holding your abdominals in. The reason for this being that when people normally breathe, they breathe into their stomach. So relax your postures, and you'll find that the stomach lets go, as you can see in both cases. And what we would like to do is to keep the stomach in. So when breathing, people generally tend to breathe very comfortably with the stomach hanging out, with what we call breathing into your stomach, really. So when you hold your stomach muscles in, your stomach supports your spine. So when the abdominals are drawn in, it supports the back. Your stomach is your second spine. So we really need to make sure that the abdominals are firm to keep the back supported. So when holding the stomach in, take a breath in. And if the breathing is restricted, then what we have to do is change the breathing, because the intercostal muscles around the rib cage tend to tighten up a little bit. So this time, breathe into the upper back. Breathe into the shoulder blades. So take a deep breath in again, keeping the abdominals drawn in, and a deep sigh out. And once again, take a deep breath in and a deep sigh out. And you'll actually notice that the breathing can become a lot easier, right? It sort of opens up your breathing capacity a bit more, because there's an entire section in the upper back where you don't realize you can actually breathe into. So this huge area that allows you to breathe better even while the abdominals are pulled in. Now, the abdominal area is an exceptionally important area when dealing with support for your back. The back is always supported with good, firm abdominal muscles. Your stomach is also known as your second spine. It's the powerhouse of your anatomy. This area here is exceptionally important because the lower abdominals support the lower back. Most people, when they pull the abdominal muscles in, are always drawing the muscles from the mid and upper section towards the spine. And they never really get into the lower abdominals. So you can do hundreds and hundreds of crunches every day and still find that you've got back pain because you can't get to the lower area down here, which corresponds to the lower back area for pain. Now, what we're going to talk about now is a thing called the B-line. This is an area of the body which people never get to work effectively. It is actually a line that we draw from the top of the hip bone here to the other side. And generally, people tend to find that this area is not an area that they can effectively work in as well as they would like to. So if you could turn to face me, Joe. Now, the B line is actually, as I mentioned earlier, a line across from hip bone to hip bone. We call it the B line because you draw your stomach in behind the line of the hips. So if we draw a line from one hip bone to another and go back to the center, now draw your stomach muscles in as hard as you can at that point there. Now, can you feel that working?
Yep.
When was the last time you felt it working like that?
Never.
Long, long time ago. So keep that drawn in, but you're not tucking under, you're not changing the shape of the body in any other area, and you're not squeezing your backside. This is very important because squeezing your backside actually can contribute to more back pain. This is not easy to handle at first, but if you draw in and keep the backside relaxed, that will eventually happen. If you find it difficult to figure out what the B line is, we can say, for women, draw that as a bikini line and draw the bikini line behind the hip bones. For the men, if you think of it as the belt line, and draw the belt line behind the hip bones. Okay? So, keeping that drawn in, now take a 5-count breath in through the nose, and a deep sigh out of the mouth. And another breath in, and a breath out, keeping the B line there for the rest of your life. This is very important. You may find that the breathing is still a little bit more restricted. You may even find that there's a reduction in back pain, and in some cases a mild increase in the tension in the back, only because the lower back muscles, which are exceptionally tight, don't want to let go. And as you B-line, those lower back muscles stretch, and as a result, they feel a bit of discomfort initially. This will go away as time goes on. Right. Now, if we can swap places, so I can now pick on Joe. And talking about posture, a lot of people stand in a very lazy manner. So what we'd like to do is for everyone to stand with their hands on their hips. Now, when you're standing with your hands on the hips, most people stand like this. In body language terms, it's an aggressive posture. So what we'd like to do here is when standing with the hands on the hips, you notice there are several factors here that are out of position. Namely, the lower back is arched, the abdominals are sticking out, the quadricep muscles are tight because the pelvis is rotated forward, and the shoulders are hunched. So from standing